I filmed this earlier. I had a lovely outdoors background with cows in a field, but there was this atrociously loud background noise from farm equipment. They knew nothing about the strange disease except its terrible impact. Typically, I would not care enough to refilm and simply just upload a shitty video, but it was bad. I wanted to upload this today, but I decided I was way too tired to film yesterday and both edit it. I am a save the best for last kind of person, and I find all the other concepts I have done research on more interesting than this, so I want to upload this first. Wish me luck in a speedy edit of this video. I am editing on a 4-year-old Chromebook, so that doesn't help. What Ebola does to the human body defies reason. It's like something out of a horror movie, not a textbook. We know very little about the origin of this virus, except that it most likely came from a fruit bat. These bats occasionally infect other animals, from primates to porcupines, antelopes, rodents, dogs, and pigs. Most strains that can infect humans are highly contagious and highly fatal, with fatality rates ranging from 60 to 90% depending on the strain. What Ebola does in 10 days takes AIDS 10 years to do. The Ebola virus spreads through contact with infected people, their body fluids, and their clothes. In many cases, Ebola causes a rapid decline characterized by fever, diarrhea, vomiting, and internal and external bleeding. There's no known cure for Ebola, but patients are treated for symptoms and some survive. The early symptoms of Ebola are flu-like, runny nose, chills, but then the virus begins to rupture white blood cells, preventing blood from clotting. In the final stages of the disease, patients' eyes turn red and the genitals swell. They have purple bleeding under the skin and are bruised all over. Patients can bleed from any opening. Low blood pressure takes most victims. Ebola can be contracted through contact with an infected person or bodily fluids, even sweat or saliva. It can take up to 3 weeks for an infected person to develop symptoms. Those infected may not be contagious in this time, but who has not ignored flu-like symptoms and gone into public? Because of its contagiousness, long incubation period, and early symptoms, Ebola can be difficult to track and contain. The strain of Ebola that emerged in Sudan in the 1970s could only be contained because it killed people so quickly that they didn't have much time to infect other people before they died. A survey that showed Americans fear Ebola almost as much as they did the swine flu in May 2009. In 2014, 14% of Americans believe that Ebola is likely to affect them or someone in their family, compared to 20% who felt the same way about swine flu in 2009. The finding is surprising. Only 6 Americans were infected with Ebola at the time of the poll. All lived or worked in Africa. By contrast, when the swine flu survey was conducted, more than 40 million United States citizens had already been infected with the flu, most of them unknowingly. It was a total mystery during its first wave that claimed 90% of the infected. A small international group of virus hunters gathered in Kinshasa. They knew nothing about the strange disease except its horrible impact on victims. Yambuk was only accessible by government aircraft, and communication with the outside world was impossible. Scientists and doctors went to villages to find entire families scattered in mud-floored huts, crying from hallucinations, moaning in pain, and blood oozing from every orifice. When wary Ebola hunters isolated the virus and stopped the outbreak, their work and the horrors they witnessed became legends in epidemiology and virology among the infectious disease community. The mere mention of Ebola was enough to cause dread and respect for those who dared to confront the virus in 1976. 19 years later, Ebola reappeared in the large city of Kikwit. It began at Christmas 1994 when a man walked into the dense rainforest on the edge of a city in search of wood that could be burned into charcoal and sold for fuel. He met an animal while camping in the forest. No one ever knew what kind of animal or how the interaction went. It was from this animal that he unknowingly contracted Ebola and carried it on his body as he traveled back to Kikwit with his charcoal. A few days later he passed away, and his family, who had lovingly cared for him, surrounded his body and posed for a sad photo. A few months later, after the epidemic spread widely from the local hospital to distant villages and clinics, a town of about 450,000 people who lived close together, house to house, with no electricity, running water, sewage, phone lines, airport, or more than a few paved roads. The fight against the virus was carried out with old-fashioned methods, rounding up the sick and the deceased, quarantining the sick, and burying the victims in mass graves. A heroic group of local Red Cross volunteers helped them, a handful of medical students, 3 doctors, and a team of 20 scientists and epidemiologists from 11 countries. The epidemic was under control in 3 months. By 2013, there were 20 Ebola outbreaks in Africa. In that time, no vaccine, treatment, or cure was developed in the 37 years since the first human case. As fatal as Ebola remained, the world grew numb to its horrors and lost interest in isolated, remote outbreaks. Rumors of an Ebola outbreak in late 2013 that spread to an area where it had never been seen before had little news coverage. By June 2014, the West African Ebola outbreak was the largest in history. For the first time, Ebola reached cities with real international airports, and the speed of the epidemic far exceeded the combined capacity of Doctors Without Borders, clinics, and hospitals, and the local government and foreign missions. The disease was the worst in South Africa. Liberia and Sierra Leone had at least 500,000 cumulative Ebola cases as of February 1st, 2015, at worst 1.4 million. Such a massacre can mean that countries lose up to 14% of their population, and the epidemic continued into 2015. In the United States, the most attention was on the case of Eric Thomas, who traveled to Liberia and was diagnosed with Ebola in Dallas, Texas, 8 days after arriving in the United States. He passed away less than 2 weeks later. His case and subsequent isolated infections in Europe explain the state of fear we experienced in 2014. According to a poll, more than 1/3 of United States citizens do not trust the government to stop Ebola from infecting them or their loved ones, and 88% of the respondents were sure the virus was coming to America. A separate poll conducted by Pew Research found 32% of Americans were convinced the virus might infect them or their families, and the level of fear correlated with race and political party membership. Black Democrats placed the greatest trust in their government's response and expressed the least fear in Ebola, whereas white Republicans expressed far greater anxiety and distrust, according to the poll. In the most well-known recent Ebola outbreak that spread panic across the world, when I was in middle school in 2014, the first case appeared to have been a 3-month-old girl whose mother was also infected. When the girl passed away, her family tried to find what illness she had passed from, but were unable to, though there were rumors of witchcraft and magic. Of the 65 people who attended the baby's funeral, 15 became sick and 11 of them passed away. Ugandan President Yoweri Museveni
Yoweri Museveni
advised people to avoid shaking hands, casual sex, and at-home burials to reduce the risk of spreading the disease. Fears of catching Ebola had twisted people's lives. They didn't feel safe going to churches, mosques, or markets. People were urged to avoid contact with animals, especially primates, and refraining from eating hunted meat, which is believed to be one source of the virus. This is the most viral and effective Ebola strain ever seen. At worst, we're witnessing an onset of deadly mutation anticipated and feared for almost 4 decades. The Ebola virus that wreaked havoc in West Africa in 2014 was a new strain. It appeared in Guinea in December 2013 and then spread to Liberia and Sierra Leone, 3 countries where Ebola had never been seen before. The spread of this outbreak was much faster than in others. The usual protective measures to prevent the spread of Ebola appeared to have been less effective in this outbreak. For example, while healthcare workers were always disproportionately represented among victims of an Ebola outbreak, this is usually because healthcare workers are simply trying to treat sick patients without realizing that the risk is increased. The reluctance of critical industries such as airlines and insurance companies to operate in the area complicated evacuations and undermined initial efforts to ensure worker safety. These issues delayed deployments, so staffing was a major challenge, with panicked no-fly zones, low recruitment, and the difficulty of figuring out what would happen if workers got sick. There simply weren't enough responders to begin with. If crisis veterans were afraid, imagine how the communities felt. As much as we may have been horrified about the disease spreading throughout the United States, the real horror was in the communities affected. They feared not only Ebola, but also the response. Strangers in hazmat suits took away villagers, never to be seen again. They endured long journeys to distant, overcrowded, poorly equipped treatment centers, and harsh messages such as Ebola is incurable. These fears apparently fueled the epidemic by increasing stigma, preventing people from seeking treatment, and referring them to their families or traditional healers. Miscommunications caused the gradual fear response at the start of the disease. Fortunately, the fear that negatively impacted the Ebola response in its early stages was eventually overcome. Communication was improved, and people have begun to accept that contracting Ebola is not completely fatal. Medical centers were built, infection of healthcare workers slowed, and care was taken to keep those infected alive. As the Ebola response began to reach epidemic proportions, fear gradually disappeared. Fear is an emotional response, not an educated, scientific, or rational response, but fear itself is not the problem. This needs to be treated as an issue for more contagious and less understood viruses that could come anytime. Ebola treatment centers offered no privacy, so those in treatment saw other patients, sometimes their own loved ones and children, in close proximity, displaying the full spectrum of symptoms, sometimes bleeding out and dying, with the corpses left out for hours. Patients were treated under strict infection control precautions. Medical staff were fully dressed in protective suits, which was disturbing and emphasized the highly contagious condition. The stress of dealing with a life-threatening illness was added to by patients not having contact with family for up to a year. Across Africa, schools and non-essential businesses were closed, sometimes even military quarantine measures, door-to-door searches for infected, community lockdowns. Mass gatherings were banned, limiting social interaction and repurposing public spaces, such as using schools as a temporary place to house the infected. Though these measures were harmful, causing panic, treating Ebola was an urgent priority based based on the realistic fear of the spread of the deadly disease. The treatment required a large number of workers, especially because wearing of protective suits made it difficult to provide treatment for longer than a short period of time. The need to treat Ebola inevitably diverted healthcare workers from treating selecting patients with HIV, malaria, and tuberculosis, leading to a preventable loss of life almost as great as the Ebola mortality itself. The origin of Ebola is believed to be Kitsum Cave in Kenya, and another deadly disease known as Marburg. In the 1990s, the U.S. military planned an expedition to attempt to identify the vector species living in the cave. It is considered one of the most dangerous places on Earth. A single bat can harbor many different viruses without becoming ill. They also carry the rabies virus, but in this case, bats suffer from the disease. Tolerance to viruses, which exceeds that of other mammals, is one of their many distinguishing features. They are flying mammals, eat tons of disease-carrying insects, and are important for the pollination of many fruits. But their ability to coexist with the virus that can be spread to other animals, especially humans, can have disastrous consequences when we encounter them. A survivor, Misupa, says the disease is traumatizing. When you realize you have it, you just see death. I was shaken physically and psychologically. When you go back to the community, they fear you. Even my own children couldn't believe that their dad came back home. A survivor, Janine, says it started with headaches, then blood all over my body. I was in the Ebola treatment center for 2 months. I felt so lonely. Doctors and nurses reassured me that I would recover and go home. Kids were sad when they saw me going. They thought I wouldn't live. Even after the outbreak got under control, the struggle continues for survivors who face the long-term health effects, significant mental and physical health challenges. Being admitted to Ebola treatment units changes them forever. Studies have shown that Ebola survivors have significantly shorter lifespans, eye and kidney problems, and social stigma from being infected, which could cause job loss and social difficulties not only for the survivor but also their families. Many Ebola survivors have had difficulty returning to work in a normal life for various reasons, physical, psychological, and social. The burden of these long-term health effects affects overall quality of life. Concerningly, the Ebola virus can be detected in sperm and vaginal fluid of survivors several months after infection. Ebola was detected in 80% of men and 4% of women tested, meaning that Ebola can be sexually transmitted. Imagine you have sex with someone and they give you Ebola. The possibility of the virus persisting in the body completely changes our understanding about what is needed to achieve control of the Ebola epidemic.